you anything.
Would you be able to give me a big cup of water?
It looks like you're having a little bit of trouble breathing, though. And since you have heart failure, I'm going to have to ask your nurse, okay?
Okay.
In the water, I'll be right in to check her out and see what's going on. Hi, Mrs. Smith. Hi. I hear you are thirsty and also having a little trouble breathing. I'm just going to take a listen to your lungs for one moment and do an assessment. But first, can you tell me your past medical history as well as your medications? And do you see a healthcare provider regularly?
Sure. I have a history of cigarette smoking, diabetes mellitus, hypertension, high cholesterol, and obesity. I can't even remember the last time I was at the doctor's, and I don't take any medications.
Okay, well, I'm just going to do an assessment and listen to your lungs. Deep breath. I'm going to check your heart rate. A little high. It's a little fast right now.
Oh.
Yeah. Blood pressure. I'm looking at the monitor. It's 150s over 90s. And check your ankles, okay? Okay. All right, let me just get your weight. Sit nice and still for me.
Okay.
Hi, Doc. Hey. Mrs. Smith in room 11 is having trouble breathing. She's crackles in her lungs, heart rate 122, BP 158 over 99, ankles have 3+ pitting edema, and she's gained 2 pounds since yesterday. She also has a past medical history of cigarette smoking, diabetes mellitus, hypertension, cholesterol, that is high, obesity, and is not on any medications, and does not manage any of her diseases. It looks to me like she may have heart failure with fluid overload. She probably would benefit from a diuretic.
It does sound like that. I'll be right over to check on her. Thank you.
Thank you.
Lasix will benefit both your hypertension and heart failure by diuresing, which will reduce the amount of fluid in your body. This will help lower your blood pressure. As Lasix helps remove fluid, it decreases the venous return or the preload, which reduces the amount of volume returned to the left ventricle during diastole, which helps improve cardiac output.
Cool, I understand perfectly now. Thank you.
Great, I'm glad that you understand. You will receive this medication while you are here in the hospital as an IV push, and when you are discharged, you will take it by mouth. I will let the nurse know, and she will be in with the medication and will provide you with the information you need to know.
Perfect, thanks.
Is there any other questions?
I don't think so.
Okay.
Hey, Mrs. Smith, I have your Lasix. After I give it, expect to pee a lot. Okay, important assessments I'll be performing on you before giving the medication is checking your weight, your input and output, skin turgor, presence of edema, blood pressure, and heart rate. I also would check your electrolytes, especially potassium, as well as your BUN and creatinine.
What side effects are common with Lasix?
Well, electrolyte imbalance is a big one, especially with potassium, as this electrolyte can cause cardiac dysrhythmias. Other side effects that are seen with furosemide include hypotension and orthostatic hypotension, hearing loss or tinnitus or ototoxicity, blurry vision, dizziness, vertigo, and muscle cramps. A more severe side effect is a skin rash, okay? So this can be indicative of one of the most adverse effects, including Stevens-Johnson syndrome and toxic epidermal necrolysis.
Oh wow, that sounds scary.
Well, it's important to notify the doctor if you experience a rash, have a weight gain of 3 or more pounds in a day, have dizziness, muscle cramps, or tingling in your extremities. To prevent low potassium, make sure to eat foods high in potassium, such as bananas, beans, nuts, and spinach. Also, make sure that you change positions slowly to prevent dizziness from orthostatic hypotension.
What about the hearing problems? How do I prevent that?
Well, While you are in the hospital receiving the medication intravenously, I will administer it at a rate not exceeding 4 milligrams per minute to prevent ototoxicity.
Okay, thanks for teaching me.
You're welcome.
I have to pee.
Okay. I'll get the nursing assistant. Potassium, as this electrolyte can cause cardiac dysrhythmias. Other side effects that are seen with furosemide include hypotension, orthostatic hypotension, hearing loss, tinnitus, or ototoxicity.
Sorry, I'm just having trouble.
I know. Blurred vision.
I'm gonna have to ask your nurse. Are you okay? She looks like you're having.
What just happened?
I'm sorry.
No, this is good. You guys should continue. This is
Okay,
fun.
it looks like you're having a
Sure.
little bit trouble breathing.